So I'm here with our Chief Economist, Nick O'Shea, and thank you for joining me, Nick. And I know you're here to tell us a little bit more about our latest briefing. So it's the third in a series of forecasting briefings we've put out relating to the COVID pandemic. We did one in May, one in July, and one now sort of end of September, early October. And tell us a little bit more about the kind of key findings and figures.
Sure. So the first two forecasts we did very much focused on what were the main factors that would influence people's mental health going forward as a result of COVID-19. This third one is a little different because what it tends to do is actually put a number onto that. So how many people are we talking that will need mental health services? And it is quite a large number. And I think just to put that into context is to say, whilst we are talking about a lot of people, it's really important to remember that actually we have time to prepare, there is support available. And so, we have to look at it within that context of, we will come through this. The numbers that we're looking at, though, as a global figure for England adults, is 8.5 million people. And that's really a combination of those who have become unemployed, the results of the lockdown, people who've had existing mental health problems, and those who have been bereaved. So it's a very big number, but as I say, it's one I think that which we can now, if we have that number, we're able to start preparing for.
Okay, so we're looking at possibly 8.5 million people in England needing mental health support as a result of COVID, which is obviously extremely concerning. Is there any kind of breakdown of figures there in terms of the problems that people might be facing?
Sure. So how this model works is because there's no original data set, because we're all experiencing this for the first time, what the model does is takes robust data and research that exists at the moment and then puts that through into this model. So we've been working as part of a multidisciplinary team with NHS colleagues to do this. It's very much been a team effort. And really, therefore, that does, to some extent, determine what the diagnoses are that we're seeing, because where the best research is where we've got the answers. Essentially, however, it is depression, moderate to severe, anxiety, again, moderate to severe, and then post-traumatic stress disorder and things like burnout. For NHS frontline workers in particular, obviously there's 1 million of those people who literally have been on a front line in unprecedented circumstances. You are looking at things like burnouts and PTSD as some of the big factors that are really going to impact them over the next sort of 2 years, really.
Okay, yeah, that's obviously extremely concerning. I just wanted to ask a little bit more about how you got to those numbers, because I know, as you say, you've been working with a team, various people within the NHS. And so, yeah, tell us a little bit more about how you came to those numbers.
Sure, it's been a great team effort, and it's very much been people doing this, because they want to help and we want to come up with the best answers. So ideally what you would do is you would take a raw data set, regress it, so use a statistical package on it, and then that would tell you what the main factors were that influenced the outcome that you're seeing. Because we've not had a pandemic of this type for 102 years, we don't have that option. So what has happened is colleagues in the NHS have gone through an exhaustive process, really, of looking at all the research that's newly available on these groups, and then really ranking those in order of what's solid, what's a green, through to what's a red. And what we've used is the strongest evidence. That's all then plugged into an Excel spreadsheet, which is, both of these things are available on our website and also on the NHS online portal that they've set up. And really, it then just takes those numbers and puts them into real life. So it works out, what the expected prevalence is, how many people you're starting off talking about, what that then means in terms of extra people. And then of those, not everyone will need a service. Some people will not. So discounting for that as well. And then trying to take into account comorbidity, that's incredibly difficult because it's unclear where you would start discounting from. So the main way in which we've done that is to separate them out, really, so you can see what each of the factors are going to be.
Okay, that's helpful to know. Obviously, the figures are extremely concerning, but it's reassuring to know that this is based on quite robust work by you and colleagues. So that 8.5 million people, does that cover adults and children?
Good question. No, so there's a further 1.5 million children, and there's less research available that's robust enough to sort of plug into the model. So what that means is that it's very much kind of general population estimates, but then also 11 to 16-year-olds who were under lockdown, essentially, and the impact of that's had on children. mercifully, the number of children in ICUs is very low, but the number who've been bereaved, who've had parents who've died, we estimate to be just under 10,000, which is a lot actually, and that covers all deaths over the period, but where you weren't able to go to hospital, you weren't able to be with that person that you love. So again, it's looking at what kind of grief support are they going to need for death's a very traumatic event anyway. I think we could all agree that actually it's not been made much better over the last 6 months because of the restrictions we've understandably had to follow.
Of course. Okay, and so I guess my response to that is, these are understandably very concerning figures to hear, and not least for those of us who live with an existing mental health condition. I guess, what can you say to that?
Sure, and I think what's really interesting about this is that this model shows that there is a large number of people that are going to be adversely affected by this, just as I think there are a large number of people that actually will have been positively affected in some ways by the lockdown because they've spent more time with family, they've gone to parks, they've had a great time. Both those things can be true. And I think what this is saying is that actually, here are the people, these are the things to look out for. Because only through doing that is then how you can actually then come up with a response. So, for example, we have a coronavirus help page on our web page for Centre for Mental Health. Similarly, other organisations are out there, and I think if you're ever going to reach out for support because you feel you need it, this is the time. And I think it's how we look after ourselves and we look after each other. But I'm just a firm believer that you can deal with anything, but you have to know what you're dealing with. And what my hope is that this work will enable people to understand the gravity, I suppose, of what is coming, but to also say, okay, so what do we do about that, and how, therefore, do we put services in place? And this model has been very much designed with local services in mind. So the reason that colleagues have worked so hard on it is because they want local areas to be able to look in their local area and come up with a very bespoke number for them that then enables them to have a local response. So that's my hope, really, is that whilst it's not good news, I just think we're better off knowing what we're up for so we can do something about it.
Yeah, no, I appreciate that. Thanks, Nick. So the idea that kind of, even though it's not great news, it's better to know and to thus be able to prepare for it than kind of pretending that everything's going to be fine. That's a helpful perspective, I guess. And so then what, as the centre, what are we actually calling for as a response?
There's, again, an interesting question here. I mean, I think our role here is to be present and to present the numbers that we have. So I think it is to say, this is the issue and these are robust figures. What is the response? And I actually feel very strongly at this point that it is really to say to government, in this case at a national level, what is your response? Because actually that is really what we're after, is trying to get people to understand that this is not all just going to be plain sailing. It's going to be a tough winter. Spring will come. That is the important thing to remember. Spring will come. However, these are the numbers. What are you going to do about it?
Okay. Thank you, Nick. That's really, really helpful to talk through that. And all the information can be found on our website. You can download the briefing there for free. Thank you to you and your colleagues for doing this work. And we really trust that the government will respond urgently and with concerted action to help everyone who needs it through the pandemic. Thank you.
Thank you.